Challenges related to homelessness, housing affordability have been for some time. Those challenges are very similar in communities of all sizes right across the country. I just had a conversation with the mayor from Ontario. It was about we need to be able to flush that toilet if we're going to bring the new housing in. And so infrastructure. And that's the challenge we face in Vancouver as well, Metro Vancouver across the province of BC. We are a big country and we do, as FCM, cover coast to coast to coast. We actually feel like this is a perfect time to recognize that municipalities need to be one of the orders of government that's at the table when we're negotiating these deals. It's very clear that the Prime Minister and the Prime Minister's team are going to move very quickly on their promises. The opportunity then, of course, is to make sure that nobody's going to start pointing the fingers at any level of government, which means let's get every government at the table to negotiate what these deals look like. We need long-term sustainable funding for municipalities. Municipalities are not an afterthought. They absolutely are at the center of what makes this country work.
What's the FCM's position on this? How prominent do you think conversation on the opioid crisis will be at your annual conference?
The federal government did identify risks around border control and ensuring that the flow of fentanyl is addressed. That needs to happen. I think that needs to happen at borders, and I think it has to happen at our ports. Making sure that the public is safe is making sure that folks who are struggling have access to the kinds of treatment and healthcare that they need. Addiction and mental health is a healthcare crisis. Out of a sense of desperation to do something to help the situation, there have been trials and they have been attempts to shift policy. We saw that in BC, and that was supported by the national police chiefs. But we're also hearing, as you point out, right across the country, there are these co-occurring crises related to housing, mental health, and addiction. And if we don't figure out how to stabilize vulnerable populations that are likely to fall into some of these cycles, it's only going to cost governments more in the long run reacting. So we need to get proactive on getting more affordable housing as a way to access services, stabilize folks in community. If people just go through treatment and recovery, put back out onto the street without stable housing, they're just going to find themselves in the same situation.